OO-ALC teammates, good to be talking with you again. This morning, we're talking with Lieutenant Colonel Dr. Gabriel Pepper, one of our MVPs in the battle against COVID-19 at Hill Air Force Base. And we just wanted to catch up with him and tell you a little bit about what we know, what's going on with COVID-19, and kind of, I'm going to ask Dr. Pepper some questions and then just let him talk to us about what's been going on. So first, Dr. Pepper, thanks for being here. And
Sure, ma'am.
I was wondering if you could tell us a little bit about what's going on in the state of Utah as far as cases, and then our local counties.
Yeah, so the cases in Utah have grown, as we've all known. I think we were hoping for a calm before the storm. I think we all anticipated a surge during the holiday seasons from November through the beginning of the year. Unfortunately, we've seen that surge before the holiday season, so we're concerned about this holiday season coming. It looks like this latest surge started in the Utah County area and has spread up through here, and it's just persisted. I think the key with that is that it's affecting younger populations, so they are healthier, they tend to have less symptoms or asymptomatic, and because of that, the spread has been exacerbated because they aren't isolating or quarantining themselves.
Yeah. And so can you tell us a little bit about what we know about the virus? I know, when we talked earlier, you said there's little known about this virus, and as we get further along, what's happening? What do our scientists know now?
So as we've gone through, we have pretty much confirmed that it is spread through respiratory droplets. Vast majority of the cases are directly tied to a close contact with a positive. So it is the respiratory droplets, which further, the mask is what really helps with preventing and capturing those respiratory droplets. So that's kind of been the thing that's been confirmed through science. Additionally, we've learned that, there's been some new data that the 6-foot bubble that we talk about with close contact, the virus can spread further than that. Although in a large space, outdoors, a place with good ventilation, those droplets are dissipated quite a bit after 6 feet. So your chances of catching those droplets is exponentially less. What they have learned, though, is that in small spaces with poor ventilation, those respiratory droplets can accumulate for up to an hour in those areas. Okay. So those are really the concerning areas right now that they've identified.
Okay, thank you. And then can you talk about, there's been recent changes to the definition of close contact. Can you talk to us about that?
Yeah, so the definition is you have to be within 6 feet of somebody who is COVID positive for longer than 15 minutes. We used to say that it's a cumulative. It's just a total of 15 minutes. So if we were here talking for 15 minutes, and I was positive, that might be considered a close contact. There was a couple outbreaks in prisons where they identified that it's not just a long 15-minute or longer exposure to somebody. It's periodic exposures for a total of 15 minutes. So if I was positive and I was coming into your office, a couple minutes here, a couple minutes there, then we'd have to add all that up because it's the cumulative 15 minutes. So that's been the big key, and that's accumulation over 24 hours.
Okay, all right. And then what about our cases on base? What are we learning from your perspective, from the public health perspective, about what's happening on base?
Yeah, so here on base, we kind of have two functions. We have the occupational medicine clinic, who kind of monitors everything for the complex. And then we have our public health flight, who kind of monitors for the active duty and the rest of the airbase wing. And when it comes to the airbase wing, we've had no transmission on base. All the positives on base have been linked to some incident off base. The same thing has occurred here in the complex, in that all the cases have been linked to some exposure outside of base. So there's not a lot of virus living on base that we're continually being exposed to. It's contacts off base, bring it on base, and now we're trying to get it off base as quickly as we can, either through quarantine or isolation.
Okay. And you made a point earlier about the difference between quarantine and isolation. Can
Yes.
you give
Yeah,
us that?
so isolation is you are COVID positive. And you need to go home and isolate for 10 days. And what isolation means is that you really should minimize contact. So in the Pepper household, if I were isolated, I would live in my basement. I would, I have a little bathroom down there, a little kitchen. I would stay down there, not interact with my family. Food would be handed to me at the top of the stairways. I would go get it and then scurry down into my hole. And that's how I would live my 10 days. I know that's not how not everybody can do that, but that's the idea of isolation, is that you are isolating yourself from everybody. Isolation is not playing golf in St. George. So, and then quarantine is you're not positive, but you were exposed to a positive. And that's 14 days. And that's really the same thing as an isolation. You should be doing the same rules as isolation for a quarantine. The only difference is that you don't have the disease, you were exposed to it. And the key to the 14 days is that you might have the virus in you. It's incubating, and then it can come out at any point. And so that's why you're doing the 14 days.
Right. And even if you have a negative test within those 14 days, it's still,
Yes.
You're going to quarantine for 14 days, even with a negative test, just to make sure.
Yes, so for instance, if I was positive right now, and later this afternoon I told you, ma'am, I was positive, and you ran and got a test, and you tested negative, you might have a false sense of reassurance that, hey, I'm negative, I can go back to work. But in actuality, you have the virus in you, but it's incubating. So the virus grows in your body for a period of time, days, and then it starts to come out of your system. And that could be up to 2 days. That's that 48-hour. And then you develop symptoms. So that quarantine is you're trying to, during that whole period the virus is incubating, you're isolating yourself because it can come out of your system at any point and then affect the people around you.
Yeah.
So that's why if you have a negative test, that doesn't necessarily mean you go back to work on a quarantine.
Yeah.
There are some incidents where, say, I have symptoms, but they're maybe allergy symptoms. I go to my doctor, they think it's allergy, they think it's something else, sinus infection. I get a negative test. We would return those people back to work because it's not a positive, they weren't exposed to somebody, and their symptoms aren't really associated with COVID. Yeah.
Okay. Well, Dr. Pepper, thank you for clearing up some things for us. It was very helpful. Really wanted to put this video and have our talk with Dr. Pepper back out to our teammates. We have seen a rise in cases across the complex, stressing to you the importance of mask wear, washing your hands, staying 6 feet away from your coworkers to the max extent possible. So appreciate everybody's help with that. And with that, thanks again, Dr. Pepper, and we're out here.